We're still talking health matters. Doctors are speaking of a surge in mental health disorders, which could be attributed to global challenges ranging from economic pressure, insecurity, the effects of climate change, adverse marital situations, or unemployment factors. Now, resident doctors of the Federal Neuropsychiatric Hospital, Yaba, Lagos State, made the need for access to adequate mental treatment the focus of the annual scientific conference to raise more awareness on this health condition. Our senior correspondent, Jacqueline Ogo, has details.
Doctors say globally there is a surge in mental disorders. Here in Nigeria, research have it that 1 in every 4 Nigerian is affected by one psychological disorder or the other, majorly arising from genetic or environmental factors. At the Federal Neuropsychiatric Hospital, Yaba, Lagos, the resident doctors in their annual scientific conference focused on strategies to ensure Nigerians embrace mental health care very seriously.
There are a lot of adverse events that can precipitate mental illness. So if we have a such, it's understandable. Your reaction to adverse events will determine whether you develop mental illness or the other.
People that walk into the hospital with mental illnesses bear witness to the fact that there is a surge, there's a rise in mental illnesses and psychological disorders in Nigeria. Top among them, of course, psychoactive substance use, schizophrenia, and amongst various mood disorders. Probably there is increase in health-seeking behavior, but we cannot deny the fact that the level of care that is given to those with mental illnesses is not commensurate to the burden of mental illnesses currently in Nigeria.
The managing director of the hospital spoke of steps being taken by the federal government to ensure more avenues are created for the people to access treatment.
Initially, we used to have about 7 neuropsychiatric hospitals, federal neuropsychiatric hospitals in the geopolitical zones. With this current administration of the Renew Hope agenda, we have 10 within a space of 2 years.
A major challenge the doctors complained about was the issue of the stigmatization of persons in need of mental health care, which also extends to self-stigmatization.
It's high time we raise awareness about mental health conditions, that it is not infectious. It cannot be contacted from people.
The resident doctors want the federal government to provide adequate funding for mental health care and the recruitment of more doctors to replace those who embraced the Japa syndrome. Jacqueline Ogo, TVC News, Lagos.